Dr. Susan Monroe. I'm the site director for the Chatham-Kent residency site. We take both family medicine residents in their first and second years, and we actually have a resident now in the third year as during an academic year and here part-time. We also take medical students in both their third year and core time and in their fourth year elective. I think if you talk to the students, I think they find an attractive spot. It's a new facility. The staff are very much akin to taking residents and students, and it's been something that the various preceptors have brought from the sites before they came here. We all moved here in August of 2010, so I think most of the preceptors were teaching at their own smaller sites, and so the larger site allows us to have more facilities. We have OTN, we have the boardroom, we have places with, we can have, better meetings. We have PowerPoint in this room here, so it just has the right facilities for teaching.
I'm David Huffman. I'm one of the Chatham preceptors at the Thamesview site, the Center for Family Medicine. I started being interested in teaching really for a couple of reasons. One, I enjoyed it. It also is a good way to make sure I keep current. I also think that our site has a lot to offer. I do both emergency medicine and office-based medicine, so I like being able to mix those two, and I think that there's a definite role for that for residents and students to really, at least if nothing else, get an appreciation for both aspects.
My name's Dax Bianchi. I'm a PGY2 family medicine resident here at the Chatham-Kent site for Schulich Family Medicine. I chose to come to Chatham kind of in a roundabout way. I initially didn't want to do family medicine, and I was inspired to do family medicine by a preceptor I had during my clerkship. And when I had that realization, I started looking around at programs, and I did a placement in Chatham, and I found that Chatham had a ton to offer in comparison to London and even Windsor, where I was doing my clerkship. The hospital is big, 300-bed facility. There are lots of specialists here. I want to practice OB as part of my general practitioner rotation, and the OB department here is incredible for volume of deliveries that we get access to, and the facilitators, the preceptors really get you involved. So there was lots of great reasons to come.
So one of the good things about our site is that the residents also have exposure to the students, and it's actually right now I have both a resident today with me and a student. The student though has a strong interest in surgical options, so I've tried to create a couple of options for them to be involved in something, and so one day he spent a day in neurology that I set up for him, and today is actually spending one day in the OR with one of the orthopedic surgeons, so he's finding that experience to be a good one. In addition to that, we have experiences that they can participate in with our family health team, so we have a pharmacist, an OT, and RT, so if they want to follow a patient that they've seen with me to a referral for an OT and see a geriatric assessment, mental status, various exams, cognitive impairment exams, they can continue to follow that patient in with the OT. The same with the RT, she does spirometry on the site, and they can look at how she's doing assessments for asthma, COPD, and also she does a lot of smoking cessation. So they can continue that aspect with kind of just follow the patient through in that model. We also have night clinics because our family health team wants to be accessible and have nights for them. So, in fact, the student is with me tonight when he's finished in the OR with the orthopedic surgeon. He'll come at 5 o'clock today because we're on for the night clinic, and so he'll see lots of children and various adults with various acute problems. So they have that exposure as well. In addition, there's a call night. The resident, they have call hospital responsibilities, and so I've had the student partner with a resident for a few nights of call with them, and so the resident gets that opportunity to teach. Today, we usually have every Tuesday a session with the residents and students come together. We usually have picked a topic ahead of time, and so they get to ask each other questions, and sometimes the level of expertise the students have is quite solid, and so sometimes we you're never too sure who's learning from who, but there certainly is that opportunity for the residents to teach at that time too.
My name is Dave Lapierre. I'm doing my third year now in Chatham at Western, and I'm doing a third year in academic medicine, and I did my first 2 years here in Chatham as well. And I chose Chatham. It was my #1 choice for a number of reasons. I was the first resident to be based here, and the opportunity to be part of something new was very exciting for me. A site visit also convinced me that clinically this is an excellent place to train. My experience backed that up. Chatham has a big hospital with a lot of acuity. There's a lot of chronic diseases, there's a lot of trauma, and so there's lots and lots for residents to see and to learn from. So it's a big hospital that's also situated rurally, and there's not very many learners here, so that creates a lot of opportunity for experience. We have a great group of family medicine preceptors here who are very enthusiastic about teaching and who also do a great deal in the hospital. So family doctors work in the clinic, of course, but also doing inpatient work and working in the emergency department, also delivering babies, doing home care. And so that experience is really valuable for people who are looking to do full service family medicine. The specialists also, there's a lot of teaching done by the specialists, and they really embrace the role of family medicine here, and so are excellent teachers also for us. We have a horizontal program in our second year, and that horizontal program really allows continuity of education in terms of ongoing experience with different preceptors over the year, and also seeing different patients over the year as well, which I think is a very valuable thing.